Welcome to the fifth section of our course, where we will explore the fascinating world of regulatory compliance and reimbursement methodologies. While knowing how to assign the correct medical code is crucial, you must also understand the strict business rules and legal laws that govern how healthcare is paid for. This topic is incredibly important because applying codes correctly without understanding compliance can lead to massive financial penalties for a medical practice. I am excited to teach you these concepts because mastering the financial side of healthcare makes you an incredibly valuable asset to any clinical team. Take a deep breath. Get comfortable. And let us begin demystifying the business of medicine. Healthcare compliance simply means following the established rules, laws, and standards set by the federal government and insurance companies. Every medical office should have a formal compliance program in place to actively monitor their billing practices and catch errors before they become major legal issues. The Office of Inspector General, or OIG, is the federal agency responsible for protecting government healthcare programs from fraud and abuse. For your exam, you must know that a strong compliance plan is the best defense a medical clinic has against an official government audit. One of the most heavily tested concepts on the certification exam is the strict difference between fraud and abuse. Fraud is defined as an intentional deception or misrepresentation made by someone with the clear knowledge that the deception could result in an unauthorized financial benefit. A classic example of fraud is a doctor purposely billing Medicare for an expensive surgery that was never actually performed on the patient. Fraud requires malicious intent, and it is considered a severe criminal offense that can result in prison time and the loss of a medical license. Abuse, on the other hand, is fundamentally different because it lacks the element of intentional deception. Abuse involves clinical or business practices that are inconsistent with sound medical or fiscal guidelines, resulting in unnecessary costs to the healthcare system. An example of abuse is a clinic that routinely bills a high-level evaluation and management code for every single patient, regardless of how minor their symptoms are. While the clinic might not be doing this maliciously to steal money, their poor business practice still results in an illegal overpayment. To combat fraud, the government relies heavily on the False Claims Act, which is a powerful federal law that protects the government from being overcharged. This law makes it illegal to knowingly submit a false or fraudulent claim for payment to Medicare or Medicaid. The False Claims Act contains a unique whistleblower provision known as a qui tam lawsuit, which allows a private citizen, such as a medical coder, to file a lawsuit on behalf of the government. If the government recovers stolen money, the whistleblower is often rewarded with a percentage of the recovered funds. Another critical law you must understand is the anti-kickback statute, which specifically targets the illegal exchange of money for patient referrals. This law prohibits anyone from knowingly offering, paying, soliciting, or receiving anything of value to induce or reward referrals for items or services paid for by federal healthcare programs. For example, a hospital cannot legally pay a cash bonus to a primary care doctor every time the doctor sends a patient to their facility for an MRI. This law ensures that medical decisions are based entirely on what is best for the patient, not the doctor's wallet. Similar to the anti-kickback statute is the Stark Law, which is officially known as the Physician's Self-Referral Law. The Stark Law strictly prohibits a physician from referring Medicare patients for designated health services to any entity with which the physician or their immediate family member has a financial relationship. For instance, if a doctor owns a private physical therapy clinic, they cannot legally refer their own Medicare patients to that specific clinic for treatment. The Stark Law is designed to prevent doctors from artificially inflating their own personal wealth through unnecessary medical referrals. Protecting patient privacy is another massive component of regulatory compliance. Governed by the Health Insurance Portability and Accountability Act, commonly known as HIPAA. The HIPAA Privacy Rule establishes national standards to protect individuals' medical records and other personal health information. As a medical coder, you will have full access to highly sensitive patient data, and you must adhere strictly to the minimum necessary standard. This standard states that you should only access or share the absolute minimum amount of patient information required to complete your specific job task. Working hand in hand with the privacy rule is the HIPAA security rule, which focuses entirely on protecting electronic health information. The security rule requires medical practices to implement physical, administrative, and technical safeguards to prevent unauthorized access to digital patient charts. This means you must never share your computer passwords with coworkers. Always lock your screen when stepping away from your desk, and ensure that all emails containing patient data are heavily encrypted. The certification exam will definitely test your understanding of how to handle electronic records securely. Now let us transition into the reimbursement side of the business and explore exactly how medical codes are translated into actual money. In the healthcare industry, patients are known as the first party, providers are the second party, and insurance companies are the third-party payers. The vast majority of a clinic's revenue comes from third-party payers, like commercial health insurance, Medicaid, and most importantly, Medicare. Because Medicare sets the gold standard for billing rules across the entire country, the certification exam focuses heavily on their specific reimbursement methodologies. Medicare is a federal health insurance program primarily designed for people who are 65 or older, and it is divided into multiple distinct parts. Part A covers inpatient hospital stays, skilled nursing facilities, and hospice care, which is outside the scope of physician coding. Part B covers outpatient clinic visits, physician services, preventive care, and durable medical equipment. Since you are studying for a physician-based coding certification, you must be intimately familiar with the rules, regulations, and coverage policies of Medicare Part B. Sometimes a physician will want to perform a specific service that they suspect Medicare Part B will not pay for, because it may not be considered medically necessary. In this situation, the clinic must provide the patient with an advance beneficiary notice, or ABN, before the service is physically performed. The ABN is a written document that explains exactly what service is being offered, why Medicare might deny it, and the estimated cost to the patient. By signing the ABN, the patient accepts full financial responsibility for the bill. If Medicare refuses to pay, to determine exactly how much they will pay for a specific service. Medicare uses the Physician Fee Schedule. The fee schedule is a massive master list updated every single year that assigns a specific monetary value to every active CPT and HCPCS code. However, Medicare does not just assign random dollar amounts to these procedures. Instead, they use a highly complex mathematical system called the resource-based relative value scale to calculate the precise worth of every single medical service provided by a doctor. The resource-based relative value scale, or RVUs, assigns a numerical weight known as a relative value unit to every procedure code. A simple procedure will have a low relative value unit, while a highly complex surgery will have a massive relative value unit. The genius of this system is that it standardizes payment across the country by measuring the actual resources required to perform a task, rather than just letting doctors charge whatever they want. You must understand the three specific components that make up the total relative value unit. For your exam, the first component is the physician work value, which measures the actual time, mental effort, clinical judgment, and technical skill required by the doctor to perform the service. The second component is the practice expense value, which covers the overhead costs of running the clinic, such as paying the receptionists, keeping the lights on, and buying medical supplies. The third and final component is the malpractice expense value, which accounts for the high cost of the liability insurance that the physician is legally required to carry. Because the cost of living and running a business varies drastically across the country, Medicare cannot pay the exact same dollar amount to every clinic. To solve this, they use a geographic practice cost index to adjust the relative value units based on the exact location of the medical provider. It costs significantly more to pay rent and hire nurses in downtown Manhattan than it does in a rural town in Nebraska. The geographic index ensures that doctors in expensive areas receive slightly higher payments to offset their incredibly high overhead costs. Once the total relative value units are calculated and geographically adjusted, they are multiplied by a single national dollar amount called the conversion factor. The conversion factor is set annually by the United States Congress, and it converts the numerical weight of the medical service into a real-life dollar amount that the clinic will be paid. If the conversion factor goes down in a given year, doctors across the entire country will see a reduction in their overall financial reimbursement. After a service is completed and coded, the clinic must submit a claim to the insurance company to request payment. For outpatient physician services, this information is submitted using a standard billing format known as the CMS 1500 claim form, or its electronic equivalent, the 837P, before the claim leaves the building. It usually passes through a software program called a claim scrubber, which automatically checks the codes for bundling errors, missing modifiers, or invalid diagnoses. Scrubbing claims ensures that the clinic sends out clean, accurate bills that will be paid quickly. Finally, after the insurance company processes the claim, they will send a document back to the medical clinic called a remittance advice. The remittance advice is a detailed breakdown that explains exactly which codes were paid, which codes were denied, and the specific reasons for any financial adjustments. Reviewing the remittance advice is a critical part of the revenue cycle, because it allows the billing staff to fix any coding mistakes and resubmit denied claims. Understanding this entire workflow, from the patient's arrival to the final payment, is essential for your career. Congratulations on completing Section 5 and mastering the vital concepts of regulatory compliance and reimbursement methodologies. You have done an incredible job navigating these complex legal rules and understanding exactly how the healthcare financial system operates. I highly encourage you to complete the attached practice test right now, to apply these business concepts to realistic exam scenarios. Completing practice questions is the absolute best way to improve your memory retention and guarantee your readiness for exam day. The practice test is included right here with this lesson, so please jump right in. And I will see you in our final section where we will conquer coding quality and exam strategy.